Hey guys, I'm Kinietz. I'm a sophomore nursing student here at Mount Union. What I'm going to do today is just take you a walkthrough of Gallagher, the nursing floor, and if you have any questions, just ask, alright? So we're going to take a look through here the faculty offices. We have Chris Pontius, our wonderful secretary, who keeps this program alive and running.
Hi.
She is the backbone of this program right here.
Yeah, I hear you.
And we have all the professors' offices down here. And I think Professor Corbicell is actually in her office right here.
Hi, guys.
Hi.
Professor Corbicell is one of our lab instructors, and she also runs a lot of the clinical experiences here. So we're just going to walk down here. We got our little tribute to nursing history right here. Just a bunch of the old gadgets and stuff that they used to use way back when. And this right here is actually one of my personal favorite spots of the nursing program. Last year, one of our classmates, Matthew Popovich, passed away. He was one of my personal best friends, and I'm just glad that we have like a little plaque to remember him. He was a huge part of this program, so I'm glad we were able to take tribute.
Very cool.
So here's a plaque of the inaugural nursing class, the class above us. We actually don't have a senior class right now. There's only three classes, the juniors, sophomores, and the freshmen right now. So it's a very new program, but it's also very exciting because we've got this brand new building and we've got all these amazing professors coming in. So it's a great deal. Right here is our skills lab. You don't really get to use this until your sophomore year. As you see right now, we have Allie Caldwell working on her post-lab work right here. What we do in here is just practice a lot of the skills. We have all these mannequins. We can actually like turn these on, listen to heart and lung sounds. As you can see, we're practicing for our farm lab final right now. Starting IVs, pumps, and all that kind of stuff. All the beds are lifelike, just like they would be in a hospital. We've got the oxygen and everything up here. We try to create like a nice ICU emergency bay right here, just as lifelike as possible because you know, the better we are at practice, the better we are in the clinical experience. We actually have two of these. We have one all the way over on the other side, but it's the exact same thing, so we don't have to get into that. And down here is just kind of like places where students study before exams or hang out before class. In here we have a nice little patient check-in room. Like when we do more of our simulations, we'll do interviews and stuff in here and get ready for our simulations. In here we have a nice little student lab. Sometimes you'll have 30 minutes in between class, bring some food in here, get some homework done on the computer, hang out, just do whatever. We do a lot of studying in between classes. In here is the simulation room. I myself have actually not had a lot of experience in this room. This is more juniors and seniors, but this is like the most lifelike mannequin that we have. This guy, he blinks, he screams, yells, spits, all that kind of stuff. So you can see he's blinking right now. This is like the most lifelike simulations that you can get. We'll run simulations in here. You can see we've got his monitor going. This is the time where they like to say, if you're going to make a mistake, do it here, because we can press a button and he's fine. But a lot of the more advanced classes have practice in here because they have the more advanced skills.
So how are these, like who runs the simulation?
The professor actually sits behind that window right there, runs the simulation. They have complete computer controls. They can run any symptom through the dummy, we can pass any kind of med. They can calculate that reaction through one of the computer algorithms and display it on the dummy. And it's more just like to see how we react and problem solve, because when we go in here, we have no idea what's going to go on. They just give us a scenario, a med list, and the patient's signs and symptoms, and we have to go from there.
Yeah, so we just have someone ask, can you earn your bachelor's at Mount Union?
Yes. The bachelor's degree is a 4-year degree, and when you graduate from the University of Mount Union, you will have a 4 years BSN degree.
Awesome. Are you a nurse or a doctor, someone said?
I am a nursing student right now. You can see I've got my nurse's stethoscope on right now. And here is the control room to the sim lab. I have no idea how any of this works. The professors run this. You see they can talk to us, and you've got all the setups in here. They got cameras to record and just kind of show us how we did, what we can improve on. So it's kind of like watching game film for all you athletes out there. It's important for us too.
And someone asked what year you are, and you're a sophomore.
I am a sophomore, year 2, so it's just got out of like the prerequisite phase with all my like anatomies and chemistries, and here's that other skill lab in there, but it's the exact same thing as the one on the other side.
And yes, it is a 4-year program.
Yes, it is a 4-year program, and we are about to be accredited. Here is our main classroom. Every single class that I have this semester, my lecture portion is in here. It's nice and spread out, well lit. We do a lot of demonstrations down here along the sides. As you can see, we had farm lecture in here a little bit earlier this morning. This is still left up from there. So,
someone wants to know if it's a direct admission.
it is a direct admission. Once you apply to the university, you then fill out a separate application for the nursing program. And once you get accepted into the nursing program, you're good to go. Some of the other schools around here, like Akron and Kent, you have to apply after your first year, and you're not even guaranteed to get in the program. But when you apply to Mount Union, you get accepted into the university, and then you get accepted into the nursing program, you are good to go for all 4 years.
And is that how you did it?
Yes, that's how I did it. Yep.
Okay, great. Someone wants to know, I think, what your hardest class has been so far?
Gosh, my hardest class has probably been, I want to say it's a tie between pharmacology and pathophysiology. I enjoy them both, but they're really challenging because it's like so much information all at once, and it's nothing we've ever had before. You can't like take a pharmacology class in high school. There's no really way to prepare yourself for it. So it's just like being able to take like large volumes of material and be able to break it down and just try and remember it as best you can.
RN to BSN. What someone asked.
We do not have an RN to BSN program. It's just a BSN program right now. We're pretty new.
Another question was, do you know what you want to go into after you graduate? Like what type of specialty?
Yeah, my specialty that I'm thinking of right now is nurse anesthetist. So after I graduate this 4-year degree, I have to work at least 2 years as an RN, either in an ICU or critical care setting, which they're both kind of the same. And then after that, I have to take the GRE, the graduate test, and then I have to apply to a nurse anesthetist school, which is actually a master's degree, but they're eventually going to turn it into a doctorate program, which is 2 continuous years.
Okay. Do you know the student to faculty ratio? I think it's 14-1 right now. But
yeah, like it's pretty great. I know all my professors. All my professors know me by name. I can pop into their office anytime I have questions or have I had problems with the test or anything like that. They're always right there to help us. They really do care about our success here, not just because we're a new program, but because they're nurses and they want to see us become nurses like them, and they really do care about us.
Someone would like to know, when will you know if you've been accepted into the nursing program? Like, how long after you apply?
Mine was pretty quick. Mine was a matter of weeks, but I know it's the earlier you apply, usually the sooner you know. But it just kind of depends on how many people apply that year and when you apply.
And as for the question about how much does it cost, that is something that we could work out with our financial aid. It's all dependent on per person, per situation.
Right.
If anyone else has any other questions, are college credits from high school accepted?
Yes, if you pass the AP exams and you have dual credit classes, I believe credit is accepted, but that's kind of like on a one-on-one basis through the director of our nursing program. He kind of sees if the syllabus is kind of close to what we have here, and if it's good enough. I actually had dual credit classes go through, but then there were some of my classmates who didn't match up to there, and they actually didn't have their credits accepted. So it really just depends on where you take it and when.
Any other questions for Randy? I've got one. What's your favorite class so far?
My favorite class is probably pharmacology. I have to go with pharm. It's kind of hard, but me being a nurse anesthetist, that's kind of like my specialty. I make sure the patient gets all the meds that they need during, before, and after surgery, and I think it's really cool. Maybe that's just what I like.
And you will know if you've either been accepted to the question that was just asked. You'll either know if you've been accepted or if you have not. One person did ask if you watch Grey's Anatomy.
That's funny. I'll get that question a lot. I have actually seen all 10 seasons of Grey's Anatomy. I have seen every single season of House. You kind of, after you like go through school, you kind of pull your hair out a little bit because some of the stuff in there is a little far-fetched. But it's funny because I have actually gotten questions right on tests because of things I've seen in Grey's Anatomy and House.
Awesome.
Don't tell my professors that, because you can't use that as study material. That's not good enough. That's just for your own guilty pleasure. But
Everyone on here seems to like it and says it's very addictive.
yeah, it's pretty addictive.
One last question from me, if we don't have any more. What made you decide that you wanted to go into nursing?
Well, actually, when I was in, I believe it was 7th grade, I had to get ear surgery. And I'd never had ear surgery. I've never had surgery before. I had no idea what was going on. So I was getting ready. I was in post-op room. Everybody was around me, you know, sticking me with all kinds of needles, giving me all kinds of meds. I was like, I had no idea what was going on. And then my nurse anesthetist, who was acting as the anesthesiologist for the procedure, walked in. He prepped me, got my history, and he took my bed out the room. He started wheeling me to the operating room. And at this point, I was freaked out. I was like shaking in my bed. I had no idea what was going on. I was super anxious. I didn't know what to expect. He stopped the bed. He came around and he looked me right in the eye, put his hand on my shoulder. He said, "Look, man, you have nothing to worry about. I'm going to be right there with you, beside you the entire time. I'm going to take care of you. You are going to be just fine." And like just like that, I don't know whether it was him or anything like that. I just felt like this wave of confidence and calmness over me, and I went in and out of the procedure with no problems whatsoever. And ever since then, like I've always wanted to be able to show that kind of compassion and that kind of care, but also combine the science of medicine and to help treat my patients and hopefully relax them in their time of need as well.
Well, it seems like you're going to be great at what you do.
I hope so.
Campus visits are available Monday through Saturday. You can go online and you'll be able to find, there's tons of times you can apply for. We'd love to have you on campus. Someone would like to know, will your classes and the commitment stop you from playing a sport if you did?
I'm actually on the men's basketball team. That's funny you should ask that. A lot of our nursing students are athletes. We have a bunch of swimmers, baseball, track, you name it, we play it. Obviously, it's really hard. It takes a lot of time management. It's hard without a sport, but with the sport, it kind of actually helps you, like, okay, I have to get this done before I go to practice. Maybe I have time for a nap. And to be honest with you, there's a lot of nights where I don't get as much sleep as I want to. But if you really are in love with the sport and you really love nursing, you'll find a way to make it work. And your professors will work with you and help you with that as well. They're very, very helpful.
Perfect. I think there's a couple people who want to play sports and also want to come here, so that's good. Yeah. Everyone's saying thanks so much. Do we have any other question? There is a girls' soccer team at Mount, and I did play on it. They're awesome. You should play. You can get in touch with the coach online, too, and she can give you a tour. If that's all we've got, then I think thanks so much, Randy.
Yeah, no problem.
If you have any more questions, you can find a whole bunch more about nursing on our website, and we'll look forward to seeing you there. Thanks.